Hey everyone, it's Mariam the Derm Doc here. Congratulations on being invited to the internal medicine training interview. This is the final and probably the most important step in your ranking. I wanted to give you a few tips and tricks. For the 2-minute presentation, focus on things that you can actually elaborate on and on topics that are potentially not mentioned in your application. No one's interested in where you went to medical school unless it genuinely links to your suitability for internal medicine. Think of one strong reason that encouraged you to apply for medicine, whether it's the complexity and problem-solving nature of the specialty, the variety of subspecialties and skill sets that you can gain, or your interest in holistic patient care. Pick something real and build on it. Try not to focus on a single specialty. You can mention you found a special interest in, for example, respiratory medicine, but don't give the impression that you only want to do respiratory or that you're set on one single thing. You might think your work in other specialties doesn't have much value, but don't forget there are loads of transferable skills. If you've arranged a teaching series in radiology, you'll definitely be able to organize a similar program within medicine. And you can use your teaching skills in any specialty. A research paper in surgery is an indicator of your dedication to research and your ability to take opportunities as they come. A leadership role in a medical school orthopedic society shows initiative and a genuine interest in helping others explore different career paths. I think you've got the gist. Moving on to the second station. When you hear the scenario, don't expect replies to your questions. You're not actually taking a history. You're going through an algorithm in your mind, and never assume. Don't assume your patient has COPD, has AF, or has collapsed. Step back and imagine you're going through different management options. Go through different scenarios in Medibuddy, but remember, anything and everything is possible. Imagine you're in acute medicine. What types of patients could you see? There you go. That's your mental list ready. To build that algorithm in your mind, you can use the BMJ best practice, which is a free resource for all NHS England workers. When it comes to handover, put yourself in the shoes of the person receiving it. What do you want to hear? A bunch of information where you only understand the point at the end? Probably not. Start with the most summarized version of your actual request. For example, I'm referring Mr. Jones to HDU for intensive blood pressure monitoring. That way, the receiver can instantly build an image in their mind and then only add the relevant information. High blood pressure in this scenario is important, but if you're referring a patient for palliative care, it probably is not as important. Best of luck, and don't forget, you're choosing one of the best specialties.